Hello, I'm Dr. Gupta. I'm a board certified plastic surgeon working in Delhi. Me and my team do a lot of cosmetic plastic surgeries. And we get a lot of patients who say that, Doc, we are very comfortable about your surgery and we ask all our questions to you and we are very clear about the procedure. But there's one thing which is bothering us, and that thing is about anesthesia. So many men and women are apprehensive about general anesthesia, which is actually the most common anesthesia done in our surgeries like rhinoplasties, breast surgeries, abdominal contouring, liposuction, body abdominoplasties. So बहुत लोगों को apprehension होती है about general anesthesia. So many people are scared about general anesthesia and they fear whether it will be fine for them, whether it will be safe, whether they. A lot of patients ask me like, Doc, will I come back from the OT and all that? They're scared and they're apprehensive, and rightly so, they may be. And I can understand their apprehensions. But I'm making this video just to take you through the journey of general anesthesia so that you understand what is general anesthesia and how we ensure and our anesthesiologists ensure that the procedure is kept totally safe for you. First of all, we believe that cosmetic plastic surgery is an elective procedure. We have to make it safe, not 100%, but up to 200% because it's a cosmetic elective procedure just for your own happiness. You are not suffering from any problem. You just want to improve one aspect of your body proportions. Hence, the safety is a top priority. Now, when we do general anesthesia, before any procedure, we do some investigations. Now, this is very, very important. Many men and women may not know about their body as much as we get out through investigations for them. So every patient, before we take off for surgery, there are some investigations which are done to know about their body systems. Hemogram, sugar, kidney, liver test, hepatitis, HIV. We also do ensure that they get your chest X-ray and ECG. If they have any symptoms related to COVID or any upper respiratory tract infection kind symptoms, we also insist for COVID RT-PCR tests. Now, all these tests tell us about your body systems. It also tells us about what your body is allergic to or has any issues with regarding them. We get to know about your kidney functions, we get to know about your liver functions, so we can tailor our medicines or anesthesia drugs accordingly. Now, if there is a patient who has some cardiac issue, we make sure that all the drugs which we give during the surgery are cardioprotective. Now, this is important. Unless we know about any body systems, we would do a general protocol which is safe in average patient. But if we know about your body systems, we will make sure that we tailor our treatment, tailor our choice of medicines which are safer for you, safer for that individual. So if we get to know that a person may have a small component of kidney issues, we will make sure that we do not use any nephrotoxic drugs. If we get to know that any person's liver enzymes are slightly raised, we will make sure that we will not use any drug which is hepatotoxic. Because these drugs are not problematic in normal individuals, but if your liver or kidney are slightly compromised, we will never use those drugs. If some patient has a bleeding tendency, we will ensure that we will not give any medicine which can hamper or cause more bleeding in such individual. So these things are important, and that's why pre-operative investigations are the most important things. So that's one. Second, before any surgery, we ensure that our patients get a PAC checkup done. Now, what is this PAC? It's a pre-anesthesia checkup. So that all our patients meet our anesthesiologists. Our anesthesiologists then understand about their body systems, their medical history, and ensure that these patients are kept absolutely safe. All our patients can at that time also discuss all their apprehensions regarding anesthesia with an anesthetist as well. Third, the surgery is always done in a hospital kind of setup. Now, a lot of surgeries across the globe are done in a daycare kind of setup, a clinic which is not fully accredited, which may not have all the safety backups, tools. So we always avoid that. We always do our surgery in a good hospital setup, making sure that the surgery is kept absolutely safe. Fourth, we make sure that our gadgets, the tools which we use during the anesthesia, are top of the line. We do not compromise on them. We always have the best of the best monitors, your oxygen supplies, your ventilators, everything top of the line to ensure safety during the surgery for our patients. This is important because I believe these are like safety belts in a car. They have to be tops of the line. They are like airbags, so we can't compromise on them. These are always kept during the surgery to keep the patient safe. Fifth, during the surgery and after it, the patients are monitored by an experienced nursing as well as doctor's team. It is never done that surgery is done and none of our patients is being observed in the recovery room immediately after surgery. These things makes the difference in safety. Hence, we always follow the standard top of the line safety guidelines for our patients. Sixth, the surgeries are always done in a hospital where there is a critical care backup or an ICU. This is also important because in any eventuality, we are always ready to tackle that for our patients so that the patients recover well and their safety is kept paramount. If you follow all these steps, the surgery is safe. If you have any more questions regarding safety about surgery under general anesthesia, please write it to us. Me and my team are always there to guide you scientifically. We can also make you connect with our anesthesiologist so that all your fears are taken care of. Signing off now. Take care. Bye-bye.